And now we present you the press conference conducted by Nathapanu Nopakun, the Deputy Spokesperson for the Ministry of Foreign Affairs at a meeting of the Center for Covid-19 Situation Administration.
Sawadee krap and good afternoon. Today is Monday, the 27th of September 2021, and this is the English language summary of the daily press briefing here at the CCSA. So today we had the general meeting of the CCSA as chaired by the Prime Minister of Thailand. There were many important information that came out from that meeting, and I'll recap that for you in a while. It also includes the decrease of the number of days in terms of the quarantine for those arriving from abroad. And we also have a forecast, the outlook of the vaccine supply until the month of December, as well as information about the blue provinces. We'll dub them blue provinces, which refer to the provinces that are in the pilot scheme for the opening up of tourism in the coming months ahead up until January 2022. So first of all, thank you to Dr. Tawisin for the Thai language briefing, and I'll start off first with the number of cases that we recorded for today. We have new confirmed case at 10,288, but we have new recoveries exceeding that number. New recoveries are recorded at 12,494. We have a declining number of fatalities at 101 new fatalities. For vaccination, we have yesterday a total of 175,000, more than 175,000 doses of COVID vaccine. Now we have a total now, an aggregate total of vaccines administered now standing at roughly 50.56 million doses, inclusive of the expatriate community. I'd like to start off first by saying that Dr. Tawisin had shown us some graphs now stressing about the strict compliance with the universal protection principle in the various organizations and government as well. Now this graph that he showed us compared the scenario wherein we have a COVID-free setting and COVID-free areas vis-a-vis the real situation on the ground. Now the real situation, the graph of the real situation is kind of like in a V shape and going up and down, but more or less quite stable as compared to the expectation of if we have a scenario that is fully of a COVID-free setting. So the death rate, however, is lower than the forecast, meaning that there is a scenario that we hope that all of the measures will be complied with, the vaccination rate and everything, as compared vis-a-vis the death rate. Now the death rate is quite lower than expected, which is very, very good news. Now for the general CCSA meeting earlier this morning, in which the Prime Minister had chaired this meeting, it considered a number of measures that would be adjusted to enable all of us here in Thailand to better cope with living with COVID. So the first result of the general meeting this morning was about the extension of the emergency decree, that although the rates of the infection in the country have stabilized, the fatality rate and the various risks still limit the movement of people. So the limitation of the movements of people are still required, and therefore the meeting resolved to extend the emergency decree on public administration in emergency situation from the 1st of October until the 30th of November 2021. Now this of course is in line with the current transition from the emergency decree to the Communicable Disease Control Act. So this transition is necessary until the new CDC Act is fully in place. And when it is fully in place, consideration would be made in terms of the emergency decree. So right now we're waiting for this transition to fulfill and that the CDC Act will be effective. Of course, also in line with the efforts right now, the current efforts to transform the CCSA and have perhaps another type of body to replace the CCSA when life returns to normal. And therefore, coming soon, the CCSA may be transforming itself in terms of as an interagency body, and there might be another type of body instead in due course because of the current situation, which is getting more stable. So this extension of emergency decree is part of the transition. It will perhaps not be until the end of November, maybe, as long as there is a transition to the CDC Act, which is fully in place. Nevertheless, the adjustment of the COVID control measures was discussed during the general meeting, and the general meeting decided to adjust a number of measures from the 1st of October onwards as well, meaning more flexibility in terms of the measures. Of course, with appropriate physical distancing and preventive measures as decreed by the province's Communicable Disease Committee. And these measures include, of course, universal prevention and COVID-free setting. Now, some of the measures that would be in place for the 1st of October, despite the extension of the emergency decree, some of these measures include that the curfew hours will be decreased. Previously, in the dark red zones, the curfew hours started at 9 p.m. Now, from the 1st of October, it will become 10 p.m. now until 4 a.m. for at least 15 days. And shopping malls, convenience stores, and markets can remain open until 9 p.m. Previously, it was open until an earlier time than this. But the sales and consumption of alcoholic beverages remain prohibited in the dark red zone area. The exhibition sites will still not be opened. And we also have information about the places such as child development centers, libraries, museums, salons, nail salons, indoor sports, for example, live music in restaurants and eateries with a limited number of musicians will also be permissible. So all of these is actually an opening up, more opening up of various venues, particularly in the dark red zone areas, despite the emergency decree. So this will be on the 1st of October, the malls being closed at 9 p.m., later than the usual time, and the opening up of cinemas in malls as well. So this will be effective the 1st of October, but the details will be released sometime tomorrow, the 28th of September, to prepare for the changes effective on the 1st of October 2021. The supply of I'll go on first to the quarantine issue first, as mentioned. So, as you may have heard, we have been opening up various provinces as a pilot project, starting with Phuket and the rest. Now, we'll call these provinces the blue provinces, which mean that they are entering into the tourist pilot scheme or sandbox, just like the way that Phuket is already so to speak, a blue province. Now, the timeline for this opening up has been discussed in the general meeting, and they came out with that the provinces, aside from Phuket, that have opened up and become a blue province, we plan for the 1st of November to include a number of provinces, including Bangkok, Chiang Mai and Hua Hin town in Prachuap Khiri Khan, for example, on the 1st of November. Now there is further than that for the 1st of December, there is plan to have provinces included in these blue provinces, or the tourism pilot phase project for the 1st of December, to include provinces such as Chiang Rai, Nakhon Si Thammarat, Mae Hong Son, as well as Ayutthaya province. And on the 1st of December, this will involve around 20 additional provinces. And finally, on the 1st of January 2022, the other provinces around the country will be opened fully for tourists. So as you see, we have this plan in place in gradually opening up the country. But of course, there is a criteria for each province that a number of vaccination percentage of the population is in place and the like. Now, in entering the country from abroad, for those traveling into the country, in terms of the decrease in the number of quarantine days, I'd like to separate this into two groups. First is the group that have vaccine documents or vaccine certificates and have been duly vaccinated for over 14 days. They will be subject to a minimum of 7 days quarantine only when arriving in the country. Now, after that, they would have to receive 2 RT-PCR tests conducted on the first day of arrival and on the 6th or 7th day of their quarantine. Now, this is, as I mentioned, for those who have vaccine documents coming from abroad. For those with no vaccine documents, no certification, or who have not received full vaccination and are traveling into Thailand via air or land or sea, for air travel into Thailand, for those without vaccination, they will be subject to a minimum of 10 days quarantine and 2 RT-PCR tests on the first day and on the 8th day, while those who have not received full vaccination and traveling into the country by land will be subject to a minimum of 14 days of quarantine with 2 RT-PCR tests as well on their first day of arrival as well as on their 12th day. In addition, just to mention that the alternative quarantine scheme for foreign nationals coming into Thailand, the rules there have become quite more flexible already as compared to the beginning. For example, those who are in the alternative quarantine can order food delivery, and there are more options for exercise as well while they are in the quarantine system. Now, just on the vaccine issue, the supply of vaccine issues, the Health Ministry has revealed that the vaccine stockpile in Thailand will exceed 125 million doses by the end of the year. And vaccination picking up pace across all segments of the population. The nationwide drive is speeding up. We have information to prove that as more vaccines arrive. And the rollout will be accelerated to cover all population segments. Now, the COVID-19 vaccinations in Thailand now have surpassed 50 million doses already. One record information was that last Friday, a record of 1.44 million doses were administered, on that day, Friday alone, 1.44 million doses. Now, in terms of the plans and outlook for the future of the vaccine supply from October to December 2021. For October, the plan is that the vaccination will cover both Thai and foreign nationals, at least 50% of all provinces, meaning in every province, at least 50% will have been vaccinated. and there would be at least one ampere or one district that would have covered above 70% of the vaccination. There will also be model COVID-free areas in the province, and an expansion of the vaccination for the elderly and those with the 7 underlying diseases and pregnant women, and also covering students and in the high school level to receive at least the first dose, to a total of at least 70% receiving their first dose. And as for the booster shot, that will be, of course, in place as well. So this is for the month of October. Now for the month of November, the vision there is that there will be the coverage of the first dose for at least 70% of the population of each province. Now in October, we aim for 50% in every province. Every province has 50%. Now for November, we hope for 70%. In November also, the coverage to include children aged and youngsters aged 12 to 17 to up to 70% in each province. So youngsters, children aged 12 to 17, 70% of them would have received at least their first dose in the month of November, as well as booster shots, and hoping that this will push through for November. Now for December, the aim is that at least 80% of people in each province would have received their first dose, and at least 70% respectively would have received their second dose in each province. So as you can see, this is cascading. It's the aim is getting higher for each month in terms of percentage coverage per province. And of course, the booster shot would be available for those who are in each province as well. And hoping that this will be the plan for for December, that we can see as a reality. The terms of the supply of AstraZeneca and Pfizer, just to let you know that in the total of 60 million doses of AstraZeneca, these will be arriving in Thailand. In addition to the supply that we already have, this will be arriving in Thailand in the first, second, and third quarters of 2022. So a total of 60 million doses by the third quarter of 2022. In addition, this purchase for Thailand can actually be adjusted to become Gen 2 or Generation 2 vaccines whenever the vaccines have been researched on and approved. So this purchase of 60 million doses from Astra next year can be adjusted to become Gen 2 vaccines. In the same manner, up to 30 to 50 million doses of Pfizer vaccine will be sent to Thailand throughout next year, in the first, second, third, and fourth quarters of next year, to up to 30 to 50 million doses in addition to the supply that we have. In the same light, this Pfizer purchase can be adjusted, the procurement can be adjusted to become a purchase of pediatric vaccines or adapted vaccines instead, as soon as the research had been approved. So I'd just like to lastly talk about foreign affairs. The Ministry of Foreign Affairs had announced that the purchase from Spain and Hungary of AstraZeneca and Pfizer vaccines have been negotiated. So from Spain, it's AstraZeneca, 165,000 doses, and Pfizer, 2.7 million doses. From Hungary, it's AstraZeneca, around 400,000 doses. Now, in terms of the pricing, these range from 1.7 euro to 2.9 euro for AstraZeneca, and 15.5 euros for Pfizer. Now, in comparison, in terms of the procurement, this is a very cost-effective purchase. And of course, there are other costs that are involved in this in terms of the delivery and the like. Meanwhile, aside from the Ministry of Foreign Affairs negotiating vaccine diplomacy and this purchase from Spain and Hungary, meanwhile, the Thai ambassador to the United States also said that the United States authorities will call a meeting of the Thai-U.S. working group next week to discuss how to proceed with the U.S. donation of an additional of 1 million doses of vaccines earmarked for Thailand. Finally, the closure of the field hospital, or the Busarakam Field Hospital, because of the decrease in number of the COVID patients. So this is a 3,700 bed hospital. This will be closed by the 30th of September, as new infections in Bangkok have steadily decreased in the recent days. So the public and private hospitals in Bangkok and surrounding provinces are thus no longer overwhelmed. So this is what I have for you, a summary of the Thai language version of the CCSA, as well as the general meeting that we have, and some additional information for the English language audience. As always, please stay tuned to our briefings. This is for the radio broadcast that we have. And thank you very much for your attention. Please stay safe, and we'll see you again next time. สวัสดีครับ
And that was Natapanu Nopakun, the deputy spokesperson for the Ministry of Foreign Affairs, giving us the updates on the COVID-19 situation in Thailand.